Have you ever caught your reflection and realized you look angry or exhausted, even when you feel perfectly fine? Every time you smile, squint, or frown, you place mechanical stress on your skin. Over decades, those repeated motions etch dynamic wrinkles into your face. As seen in this cross-section of the dermis, young skin easily bounces back. But as we age, our natural scaffolds of collagen, elastin, and hyaluronic acid deplete. Without that structural support, a temporary expression line folds repeatedly until it becomes a permanent furrow. Many people want to stop this daily wear and tear on their skin, but they hesitate. They picture the stiff, expressionless, or perpetually surprised looks that come from poorly executed cosmetic work. Solving this issue requires going beneath the surface. To smooth the skin without paralyzing the face, we have to treat the mechanical root cause of the wrinkles. The solution actually originated in the 1980s. An ophthalmologist was searching for a way to treat blepharospasm, a severe medical condition causing uncontrollable, rapid eyelid spasms. While treating patients for these spasms, doctors noticed a curious side effect. As the medical tremors stopped, the cosmetic wrinkles around the patient's eyes completely vanished. This microscopic animation shows exactly how it works. Purified botulinum toxin type A acts as a gatekeeper at the neuromuscular junction. It temporarily blocks the chemical signals that tell a specific muscle to contract. With those nerve signals muted, the targeted muscle relaxes. The overlying skin finally gets a period of mechanical rest, allowing the deep creases to smooth out naturally. Because this process alters your actual neuromuscular activity, treating it like a simple salon service is a mistake. It requires rigorous surgical-grade precision. The human face is not a flat canvas. It is a highly complex, three-dimensional system made up of 43 interwoven muscles. This anatomical map illustrates the tug-of-war beneath your skin. Levators pull upward, depressors drag downward. Dr. Hause acts as a structural architect, mapping movements to target only overactive depressors. This demands absolute accuracy. A millimeter of variance can throw off your entire facial structure. True facial harmony is achieved by softening the deep lines while completely preserving your ability to smile, frown, and communicate authentically. Today, this intervention is highly efficient. Using ultra-thin needles, the procedure takes less than 15 minutes, allowing you to return to your day with zero required downtime. However, the success of the treatment relies heavily on the first few hours afterward. Patients are strictly forbidden from rubbing or massaging the treated areas. This diagram illustrates the risk of migration. If physical pressure forces the liquid neurotoxin out of the targeted muscle and into an adjacent zone, it can temporarily weaken unintended areas, causing your eyelid or facial features to visibly droop. Avoiding that frozen or drooping appearance is a direct partnership. It requires the surgeon's exact execution in the clinic and your strict adherence to the aftercare instructions at home. You will begin to see a subtle relaxation in the treated areas within a few days, leading up to the final polished reveal at the 7-day mark. These effects typically last between 3 and 4 months. As the muscle activity gradually resumes, a maintenance treatment is needed. Regular maintenance stops dynamic lines from etching into permanent static wrinkles, effectively pausing the mechanical stress that creates deep-set furrows. Residents of the newly expanded Fruitridge Pocket area and the greater Sacramento region now have direct access to this level of expert anatomical care. To achieve total facial harmony, call Sacramento Aesthetic Surgery today at 916-646-6869 or visit housecall.com to book your personal consultation with Dr. Hause.